In Kenyan hospitals, medical interns are increasingly relying on Google and YouTube for guidance during critical procedures. This alarming trend, revealed in a recent study, raises serious concerns about patient safety and the preparedness of new doctors. The study, conducted across multiple hospitals, shows interns grappling with complex surgeries with minimal supervision and practical experience. The findings highlight a global crisis in medical training and the urgent need for improved support systems for young doctors. The transition from medical school to real-world practice is daunting, and the lack of adequate supervision can have dire consequences. The study's authors are calling for immediate action to address the over-reliance on online resources and to bridge the gap between theoretical knowledge and practical application. This reliance on Google and YouTube is a symptom of a deeper problem, a systemic failure to adequately prepare young doctors for surgical practice. The consequences can be catastrophic, potentially leading to medical errors and loss of life. It is imperative to address this issue for the sake of patients and the well-being of future doctors. The study's findings serve as a wake-up call for the global medical community to examine internship programs and provide the necessary tools and guidance for new physicians.
Kenyan hospitals, often understaffed and under-resourced, are grappling with a surge in patient numbers, placing immense pressure on healthcare systems. Medical interns, eager to apply their knowledge, are thrust into this challenging environment with limited guidance. The shortage of experienced surgeons and overwhelming workload create an environment where supervision is often insufficient. Interviews with interns revealed a pervasive sense of anxiety and uncertainty. Many expressed feeling overwhelmed by the volume of patients and the complexity of cases. The lack of readily available senior doctors for consultation forces interns to seek alternative sources of information, often turning to the internet. This reliance on online resources, while convenient, is fraught with risks, as the accuracy of information can vary greatly.
Sometimes Google feels like my only option, confessed one intern, his voice laced with frustration. He recounted an incident where he struggled to control bleeding during a complex surgery and discreetly reached for his phone, hoping Google would provide a solution. His story is not unique. Countless interns shared similar experiences, highlighting a concerning trend in the medical training system.
Another intern described her first encounter with a complicated childbirth, where the baby was in distress and the senior doctor was unavailable. "I felt paralyzed," she admitted. "I ended up searching for a YouTube video while trying to keep the mother calm." These first-hand accounts underscore the immense pressure and responsibility thrust upon young doctors with inadequate support systems. The emotional toll is evident in their voices.
"You go into medical school with so much idealism, but then reality hits you," shared a young intern. "You're thrown into the deep end, left to sink or swim, and often you feel like you're drowning."
These stories are a stark reminder of the systemic failures putting young doctors in untenable positions. We must listen to their experiences and work towards creating a more supportive medical training environment.
The transition from medical school to the unpredictable terrain of a hospital ward is a jarring experience. Medical education often falls short in bridging the gap between theoretical knowledge and practical application.
This disconnect becomes glaringly apparent during internships, when newly graduated doctors are expected to apply their knowledge in high-stakes situations. The lack of sufficient practical training leaves them feeling ill-equipped to handle real-world medicine.
To bridge this chasm, medical education needs a paradigm shift, emphasizing experiential learning and mentorship. Medical schools must prioritize developing critical thinking, problem-solving abilities, and effective communication techniques. Furthermore, internship programs must be restructured to provide a more supportive transition into clinical practice.
By bridging the gap between theory and practice, we can empower young doctors to confidently navigate the complexities of medicine and provide safe and effective care to their patients.